Hi, I'm Lynda Giovanello, a nurse and a clinical liaison at the Walpole area VNA in Massachusetts, and I'm here to talk about using home health care as a supplement to family care. A lot of people believe that they have to make a choice between caring for a loved one themselves or having nurses come in or paying for private help. In actuality, private home health agencies and visiting nursing agencies can partner with the family so that the family can continue to help provide some care, and so can the home health agencies. I'm here to talk with Beth today about and answer some questions she has about caring for her mother who's been in a rehab. How you doing, Beth?
Hi, Linda. Thanks for spending time with me. My mother has been in rehab. She was hospitalized initially, status post-fall. She developed pneumonia while at rehab. She does have mild dementia, and she has been living alone. So we have had some issues at home with caring for her. So my thought is, can we receive home care once she goes home, and how do we initiate that?
Okay. Well, as you say, if she's in a rehab, initiating that will come from the doctor at the rehab. The doctor will, based on his information from the nurses and the therapist, will determine if she still, in fact, does need skilled home care. And if she does, skilled home care would be nursing or physical therapy, and the doctor will order that. And the case manager at rehab will then let you know for sure. And to start that relationship, what you should do then is, there's a website, www.thinkhomecare.org, and that's the Massachusetts, the Home Care Alliance website. And on that website, it lists all different kinds of home health agencies, licensed agencies for skilled care, nursing and the speech therapy, physical therapy, all the skilled types of care. Then they also have listings of private care. The skilled care is covered by most insurances and from most VNAs, but private care is either paid for by the patient or their family, or most long-term care insurances cover private home care. And so to start the relationship, what happens then is, if you go on the website and see what agencies, what visiting nurse associations are near where your mom lives, you can then choose which home health agency you want. Home care is a patient's choice. You don't have to go with a home health agency from a particular hospital or facility, or just because one is in your town. The patient gets to choose which home health agency they'd like. And once you go on the thinkhomecare.org website, you can then peruse and look at different home health agencies and see which one will best fit your need. And then what happens is, once you choose the agency and the doctor orders the home care, when your mom gets home, the next day a clinician will come out, most likely a nurse if he's going to order nursing, and do the start of care for your mom. And that first visit is usually the longest visit. It takes about an hour to an hour and a half, because the nurse is gathering information, some history, and doing a full head-to-toe assessment, checking vital signs in lungs and pain and incision sites, her neurological status, and how safe she is at home, and can she remember to take her meds. And at that visit, the nurse, along with your mom and you or your sister, if you're present for the visit, which is great to have family members present, the nurse will go over the plan of care, and based on how your mother is at that visit, then they'll determine, nursing will be out 2 or 3 times a week, or 3 or 4 times a week, depending on your mom's needs. And then, based on the plan of care, they'll be out the following week, or within the next couple of days. And that's how the relationship starts.
Could she have somebody help her with her shower if need be?
If need be, she could have a home health aide. That's someone who helps with personal care only. The showering, making the bed, tidying up the bathroom, that kind of thing. Home health aides, some people confuse home health aides with homemakers. A home health aide that comes in with the skilled clinicians as well. When someone's on VNA services and they have nursing and therapy, they can also have a home health aide while a skilled service is in, but that home health aide just does the patient's personal care. Homemakers from private agencies, they can do more. They can do house cleaning and errands and meal prep, but the home health
Can
aide...
the nurse help me out with getting a homemaker?
They can. They can give you a list of private care agencies that can serve the area where your mom lives. But again, that thinkhomecare.org website has a whole list of the private care agencies as well.
Oh, okay.
That you can choose from.
And what can my sister and I do to help out?
You would do what you normally do every day. The home health agency isn't there to take over or interfere or change routines. Your mother's at home because she can be at home. We want to keep her at home and keep her happy and independent. But so whatever you would normally do, we're there to supplement and get her back to her baseline level of functioning and independence. You know, you can learn from the nurse. The nurse could teach you how to give medications, how to fill the pill boxes. I don't know if your mother uses a pill box, but with a lot of older folks who may start to have some forgetfulness or dementia issues, these pill boxes are great. The nurse can teach you how to fill out, read the pill sheet with the medication, the dose, why she's on certain pills, and show you how to fill it in each week. You could fill that in for your mother if she needs it. You could give her reminders, socialization, where she'll be primarily homebound. You don't want her to start feeling isolated. Visitors are great. Any helping with laundry, meals, whatever you normally do.
Well, that's nice to know, Lynda. Thank you for all the information today.
You're welcome.
It'll help with her transition to home.
Good, I'm glad. And just remember, thinkhomecare.org. That's the website. Thank you.